Children are vulnerable for no other reason than they're children. And lack of knowledge makes them even more vulnerable. So it's about increasing their knowledge. You've got to hit the nail right on the head. Don't fluff around the sides. Don't go around the outskirts or be a fringe dweller. You have to attack the problem. And by attacking the problem is talking about the sex word, talking about private parts of their body, using the correct names such as vagina and penis, and just empowering children. I think that's what it's all about. It's about empowering them, because children are disempowered simply because they're children. So what sort of power can we give them without ruining their innocence? Parents think that their children don't know anything about sex, or they have no knowledge of sex. But if your child catches the bus to school, if they've come out of a junior learning centre and they're with the big kids at school, they're hearing the words. It's all around them. Media, it's all around them. Songs, sex is in every song that you just about listen to. So it's naive to think that their children don't know. Grooming is a big part of it. Grooming and the grooming process is what puts it all together. And grooming can take weeks, it can take months, it can take years. And pedophiles or sex offenders or pederasts have actually been quoted as saying that they won't offend against a child unless they are 99% sure the child will keep a secret. So the grooming process works in gaining the child's trust, and if it's someone that they're related to or that they love or that they spend a lot of time with, that's usually in place anyway. And therefore, perpetrators will gravitate to those situations and create those relationships with children to gain that trust. Once the trust is gained, then bribery will start coming in, or emotional intimidation or manipulation. They will try more innocent but forbidden activities with the child to see if they'll keep the secret. And once they've got themselves to a place where they think the child will go through with the sexual act and keep it a secret, then the sexual act takes place. After that has occurred, then there could be threats to keep the secret. But unfortunately, most children are willing participants initially because of the lack of knowledge that they have in this subject, because formal education or parenting hasn't been so strong in this area in years gone by. Then parents aren't handed these skills down to teach their parents. And if it's not being taught at schools, although it is being taught at schools, if it isn't being taught at a school, this is not something the child will just get. It's not developmental. It has to be taught for them to grasp it. And once a secret's in place, it's very difficult for the child to actually come out and disclose something that they think that they're actually going to get into trouble for. So one example would probably be, if you're looking after someone else's children, giving them lollies before they go to bed, or giving them sweets after they've brushed their teeth, and then saying to the child, "Don't tell mummy about this because we'll get into trouble," or "Don't tell mummy because you'll get into trouble. This will be our little secret." Things like that. Or I worked on a case once where there was a male person who was living in a caravan, and he would get children in his caravan, and he would make sure that the children could see his genitalia and place himself precariously so they would see his genitalia, because he'd wear big baggy oversized shorts, no jocks, and he'd make sure they'd see. And then if they saw them, he would say to these children, "You better not tell your mum that, you'll be in big trouble for looking at that. You shouldn't have been looking." So putting the onus back on the child, putting the blame on the child, and seeing if the child would say something. And for those children who didn't, he would then work on them and then offend against those children. But if the child came back and said, "My mum said you should wear jocks," well, then he would know, well, that child's gone and said something, so cross that one off the list. 1 in 4 children, generally, across the board, mainstream children, 1 in 4 will be offended against or affected by some form of unwanted sexual contact before 18. But when we have a child with a disability or a special need, that doubles, so 1 in 2. So that's basically what we're talking about, is we're talking about half of the children with disabilities will have some form of unwanted sexual contact before 18. So whilst it's important for all children, the risk factors double for children with a disability. Children who live in an environment where they have a single parent as the primary caregiver are at higher risk as well, because statistics tell us that children who are in a single parent family are at higher risk of being offended against, because perpetrators, again, based on what we were talking about earlier, will gravitate towards single parents, because one parent is easier to overcome than 2. quite often if there's no father, they can easily fill that fatherly role. There's a void and they can fill that void quite easily. Single parents in some instances, appreciate support, appreciate company and appreciate help with the children, and they're probably more open to accepting that help. I just need to say, Marnie, that it's not about poor parenting or poor single parenting. It's about gravitation of the offender towards single parents for that reason. And there's a professor called Professor David Finkelhor. He's an American man, and he's regarded as the world expert in this field. And he's come up with a model to help us to understand how this happens and why it happens. And why does it happen to children more times than once? Is it not bad enough that this should happen to a child once, and we're seeing children who are victimised by more than one offender? Why does that happen? Well, David helps us to understand that by 4 preconditions to the occurrence of child sexual abuse. Those conditions being sequential in nature, so they have to follow each other, they have to be done in line. The first one is motivation. Firstly, for someone to have sex with a child, they must be motivated to do it. So something must be motivating them. The things that motivate offenders are reenactment, so something that's happened to them as a child, and then doing it again. What we're seeing, Marnie, is a lot of adolescent offenders now, more than we ever did. 1 in 3 offenders in the statistical data that's collected on this shows an adolescent offender. So they're starting even younger. So reenactment, something that they've learned and redoing it. Part of the reenactment sometimes is payback, believe it or not. If that's happened to you, you would think, oh, well, I'm never going to do that. But we do know that some do it to get back on society, some adolescent offenders particularly have been quoted as saying that when I'm offending against a child, my pain is getting transferred to that child. So the pain I'm bearing, the pain I'm carrying because it happened to me, is being transferred. So payback, or where was my protection when I was a child? So getting back on society as a whole. It could be, and quite often it is, a sexual attraction to the child. So they're sexually attracted. We find that a lot of offenders are also engaging in normal sexual relationships or adult sexual relationships, but the level of satisfaction they gain is not as high as it is when having sex with a child. And then there's power and control as well. For people who have a deep desire to exert power and control, find that difficult in the everyday sense, well, we'll find it quite easy to exert power and control over a child. So they're the main motivators, but that's not enough. You still need more. To then offend against a child once you're motivated to do it, you must overcome your internal inhibitors. And basically that's your conscience. Well, most of us have a conscience, but those who have been offended against, their inhibitions are lowered from the beginning. Their social conditioning maybe hasn't been strong enough to tell them that it's taboo. Maybe they have an impulse disorder, or not always obviously, but in some cases it might be a mental disorder, and that would lower their internal inhibitors. And of course then there's drugs and alcohol that do that exact job. They lower their inhibitions. And pornography. Pornography will also act on lowering the inhibitions or the conscience of a would-be perpetrator. That said, they then have to gain access to the child, and that's the 3rd precondition, which is gaining access. And it's for this reason that they gravitate towards children. We know that relatives, sporting and community groups, and teachers are the 3 highest categories of offenders. Now that's no coincidence, because they're around children. They've got a position of authority or a position of supervision. If I can give you an example, the football coach. Well, the boys love the football coach. They idolise the football coach. He's in a position of trust, he's in a position of authority, and he usually has a good hold over children. And so perpetrators will gravitate to those types of areas where children are easily accessible. They're a position of authority, so to gain their trust is quite easy. And environmentally, they then have to get the child into a position where they can actually have the sex with the child. You can't do that in the street, so then they have to get them into a position. So those are external inhibitors, gaining access. And lastly, and this is where prevention education programs such as ours comes in, is overcoming the resistance of the child. Now that's not to say that if the resistance is overcome, it's the child's fault. Quite the contrary. The blame always lies with the perpetrator. But what we're saying, and what David Finkelhor is helping us to understand, is that perpetrators will not offend against children who resist, who tell them to rack off, I'm not doing that, or that's not okay. My mum said that's not okay. Or in our family, we don't keep those types of secrets. So perpetrators, based on the grooming process that we talked about earlier, will choose children that are going to offer the less resistance, choose children that are going to give them a better chance of getting away with the crime that they're about to commit. They will choose children who lack assertiveness or self-confidence, or have poor relationships or no relationship with the parents, and for those reasons they become vulnerable. So a child that is able to resist is less likely to be offended against. And that's the fourth precondition, and the most important where we come in, is developing resistance. For example, the easiest way I can do that is by saying children at 5 years of age know they're not to steal, because there's a lot of mediums that give them that information: parents, teachers, aunties, brothers, television, storybooks. So if an adult asks them to steal, there's resistance. They can draw from their resistance because the knowledge that they've gained has created a resistance. But when we're talking about sexual abuse of a 5-year-old, because nobody's put that information in the basket, because they don't hold a knowledge base, where's the resistance going to come from? So we're not saying to teach children at 5 sex. We're telling them to teach them protective behaviours, so there's knowledge in the basket. Children today seem to be more confident and more assertive, and when we talk about protective behaviours, they talk about, the right to feel safe, and some would argue that children have too many rights today compared to days gone by. And even the most assertive and the children who can problem solve the best seem to struggle in this area. And the reason they struggle is because it's a process. It's a drawn out, premeditated process that the offender will use against the child. And therefore, children find it very difficult to problem solve or to work against perpetrators unless they've been taught how and been taught specific strategies and skills to actually protect themselves. Like any personal safety program, like any crime prevention program, you need to know the ins and outs of what it is that you're trying to do. So there's the program called Protective Behaviours. It's a prevention education-based program. But further than that, it's also a life skills program. So it's a program that can be applied to any unsafe situation, but specifically sexual abuse. So it's concepts, it's strategies, it's themes, it's an ethos, it's a way of living your life, and it's a process within a process to protect individuals. We know that most children who are sexually abused are abused when they're not with the main supervisor or primary caregiver, and therefore a certain amount of onus, as sad as it may be, a certain amount of onus falls back on the child to protect themselves. And that's just how it is. Most parents, their greatest fear is the stranger abduction or a stranger doing something to their children. But statistics tell us, not only Australia-wide but worldwide, whilst it does happen, and to those children and families that it affects, sexual abuse by strangers accounts for only approximately 4% of the actual incidents across the board. So the greater majority occurs by people they know, people they trust. But stranger danger, even in the media, still gets a lot of attention because they know that that's going to affect families and mothers and caregivers. That is, it's high on the agenda of fear factor for parents. But what we say to parents is that stranger danger is important. It is important, and you can't not teach stranger danger. But you have to teach it under a much bigger program and within a better process of protective behaviours, where we still identify skills to deal with stranger danger, but we also give them skills to deal with a whole range of other scenarios, and in particular, abuse from people they know. It comes back to the process of protective behaviours. It's not a one-off talk. It's not the talk situation. It's about trying to teach parents when they have children, when they give birth to children, to start putting in the concepts from birth. So it's a life skill. So from little small children, you tell them to use their manners. So for example, you're giving them a biscuit and they're only 1 year of age. You're trying to teach them to say ta or thank you from one. Well, we teach this program from birth as well. So using anatomically correct names for private parts, for example, with very small children, for teaching them from a young age not to touch other people's private parts in the bath and not to let people touch yours. And then as they age, the scope gets more intense and it gets harder to grasp, but it's age appropriate. So basically it's from birth, so it's not a one-off talk. And we talk about their right to feel safe, what to do if they don't feel safe, are they allowed to keep secrets, the private parts of their body. We teach them to be assertive. We teach them to keep on asking if they need help. We develop networks for them of people that they can go to and speak to. And we don't even have to specifically talk about sexual abuse for the program to work, because in essence it's a child safety program. So it would work effectively against bullying as it would sexual abuse by being quite generic. However, we've found by being specific, you have a much better success rate of preventing offences from occurring.